Sleeping issues with children is one of the most common reasons for parents to consult health professionals. Most parents expect sleepless nights in the first few months, but if it persists beyond those few months, it can take a toll on everyone in the family. Research shows lack of sleep can affect our physical and emotional well-being. It leads to parental burnout, problems at work or school for children, mental health issues such as depression and anxiety, postpartum depression, and it is linked to increased incidence of domestic violence, and generally it can make it impossible for day-to-day functioning. I'm Dr. Gina, and over my 15-year career as a paediatric doctor, I've helped thousands of parents successfully navigate sleep training. Sleep training is a contentious topic and everyone will have an opinion on it, and some views can be quite polarising or extreme. In this video, I will share with you the essential steps to getting your baby or child sleeping through the night, and we'll discuss some of the misconceptions many parents have. I will share the very same techniques that I used to ensure that my two girls were sleeping through the night from 6 months. Make sure you watch until the end, where I will reveal my #1 tip to guarantee sleep training success. The key to sleep training effectively is not about following specific methods or letting your child cry, but introducing the concept of good sleep hygiene, where baby or child can recognise a familiar bedtime routine, fall asleep independently, and develop those positive sleep associations. Sometimes when I raise the topic of sleep training with my patients, they get very upset and worried because they don't believe in the concept of sleep training. Usually when I dig further into these fears, they are always based on misinformation and misconceptions. Thousands of studies on sleep training have been carried out over the years, and they show that sleep training does work and it does not have any adverse outcomes on attachment or bonding between parent and child. The two common fears parents have are, firstly, will it affect our bonding? This is so not true. There are plenty of hours in the day where you are engaging with your child, giving them hugs, kisses, and being present, which is teaching your child that you love them and helping them form secure attachments. It will not affect them in the slightest if you are not doing that during the 10 minutes before bedtime and naps. Secondly, will sleep training cause stress to my baby? Some parents in the past have been concerned that crying causes high levels of cortisol, a stress hormone, to be released. High levels of cortisol can have an effect on the developing brain. In the wake of these concerns, there have been several studies which have looked at the cortisol levels babies produce whilst going through sleep training compared to babies who are not sleep trained, and they have not found any difference at all. In fact, some studies showed lower cortisol levels in babies that were exposed to the sleep training methods that I will show you in this video. Not all babies and children need to be sleep trained. Many will learn how to do it themselves. However, if your child's sleep is really affecting your quality of life, your day-to-day functioning, your mental health, or the ability to be the kind of parent you want to be, then it really can change your life. I've never had a family come to me and say, I wish I hadn't sleep trained my child. They are usually incredibly grateful that it worked, or they wish they had tried it much sooner. So you've made the decision to sleep train your child. We will quickly discuss when and how to start sleep training. Firstly, what age to start. This will depend on you, your child, and your family. You can sleep train your child at any age, but it is harder the older they get. It is very easy to sleep train 6 to 12-month-olds. 3 to 4-year-olds are tougher, but not impossible. Sleep training can also work even if you are co-sleeping. You will need to ensure that you are emotionally ready, and so is your partner. It absolutely will not work if you or your partner are not on the same page and one is not ready. As a rule, definitely do not try sleep training before 4 months of age. Before then, babies need responsive parenting. Young babies need you to be with them constantly, and this helps them develop secure attachments in an unfamiliar world. By 4 months, most babies will be putting on adequate weight, and from a development point of view, they are ready. If you do wish to start at this age, you should check with your paediatrician or health professional to ensure that they think baby is physically and developmentally ready. Secondly, finding the right time. Find a week in your calendar where you'll be free or not super busy so you can devote your time to it. You will need to make sure you're at home for all nap times and bedtime routines with no interruptions. It can be a pain, but it is just for 1 week, and I promise you it will be worth it in the long run. You also have to make sure it's a good time for your child. Make sure they are not unwell, teething, or no major transition is coming up. Now we are ready, it's time to implement. Remember, the goal of sleep training is to get your child to sleep independently with positive sleep associations. How you get them to sleep is crucial. If they need to be rocked or fed to sleep, then when they wake through the night, they would need the same to help them fall back asleep. Now I'll talk through the essential steps required to successfully sleep train your baby or child. 1. Develop positive sleep associations. In those first few weeks, baby will want to be close to you as much as possible and will be feeding constantly. As they spend 16 hours a day sleeping, it's likely that they will fall asleep whilst feeding or being held. As they grow out of this phase of needing to be with you all the time, try and get them into a routine of falling asleep in their cot or bassinet. Even if they fall asleep whilst feeding, you can gently place them on a changing mat or check their nappy, which will wake them up slightly. Whilst they are in the semi-awake stage, you can transfer them to their cot or bassinet. They will quickly learn to fall asleep on their own, without the need for rocking, feeding or sucking. This also applies to nighttime feeds. Once fed, place baby back in their cot or bassinet whilst they are still semi-awake. Many of us will give baby a pacifier. Sucking greatly comforts baby and many babies will like sucking, which can help soothe them. If you are introducing a pacifier, then give it to them to help them soothe, but remove it before they fall asleep so they do not associate sucking with falling asleep. This will satisfy their need to suck without the unintended association with sleeping. This will also help prevent those fretful nights when baby keeps losing the pacifier and you have to put it back every hour or so, which is enough to break even the most patient of us. 2. Pick up on sleep cues. Overtired babies will fight sleep. They will start to show signs of being tired. They might not be interested in toys, they may be rubbing their eyes. Try and pick up on these early cues and place baby in their cot and bassinet. If they become overtired, then trying to settle them can take hours. If they are overtired, then you may need to rock or comfort them to help them settle and then put them into their cot or bassinet to get them to fall asleep. 3. Help them distinguish between daytime and nighttime. Babies are not born being able to differentiate between day and night. Evidence shows babies sleep much better when it is dark. Try and make nap times and bedtimes as dark as possible with minimum stimuli and disruptions. Use blackout curtains if required. If there's a lot of background noise, use a white noise machine. Get them used to sleeping in the same place for naps and nighttime. For older kids, have a set time bed routine, such as bath, cleaning teeth, and reading a book. Try and stick to the same routine each day. Keep their room dark. If they're scared of the dark, use a night light, and if there's a lot of noise outside, you can use a white noise machine. Step 4. Implement sleep training. There are several methods to choose from. I will discuss the 2 most common methods that I use. I personally do not use or would not recommend the cry it out method. First method is pick up, put down, and shush pat. For parents that want a very gentle approach and minimal tears, then this technique works very well, as it allows you to determine the pace depending on what you are comfortable with. The trade-off, however, is that it can take weeks or longer to fully implement. This is a useful technique to help babies over 6 months to start falling asleep on their own and to get rid of any negative sleep associations they have. For younger babies from 6 to 12 months, this may be all that is required. When they are sleepy and showing signs of sleep, place them in their cot and shush or gently pat them. This gives them the reassurance of having you there, but they're still learning the skill of falling asleep on their own without the need for feeding to sleep or rocking. If they start fussing a lot, then increase the shushing and patting. If they start to escalate, then you will need to settle them by picking them up to calm them down. Once they are settled, place them back in the cot and start again. Every few nights, reduce the amount of interaction to the point where you do not need to shush or pat them and they can fall asleep independently. For older kids, you do the same, gradually reduce the interaction. If they wake in the night and come into your room, you gently take them back, hush and pat them and get them to fall asleep in their own bed. The second method is check and console. This particular method is also known as the Ferber method, graduated extinction, progressive waking, or the interval method. For parents that can cope with some tears but want to introduce sleep training quickly, maybe you have to go back to work, this method can work very quickly. There are many variations on the check and console method, but the general principles are the same. You want to continue to check on your baby or child at preset intervals so they know you are there, and then gradually increase the intervals. To do this, develop a bedtime routine and stick to it, as babies and children like consistency. Stick to the same routine each night and they will become familiar with it. After going through the routine, place baby or child in their cot or bed and leave the room. Wait a specific time such as 1 to 2 minutes and then go back into the room. When you go in, reassure them with words such as "it's sleepy time" or "we love you," or you can gently pat them. Use words or gently patting to soothe baby so they know you are there but do not pick them up. Continue to leave and then check on them, increasing the amount of time between visits until you've reached about 10 to 15 minutes, and then keep at it until they fall asleep. If they wake up, you start the whole process again at set intervals. If they're really upset and they've worked themselves up into a frenzy, then you will need to go in and comfort them and try again the next night. Remember, the goal is to have more and more successful nights each week until their sleeping is cracked. You will have setbacks, but it is important to continue to persevere. For older kids, the same principles apply. Whichever technique you use, make sure you are consistent. This means all caregivers need to be on the same page and practice the same routine. Your child will be really confused if some nights they are rocked to sleep and other nights they are left to cry in a cot. It absolutely will not work if everyone is doing different things. If as parents you have very different views on sleep training, then decide on a middle ground and use a method or part of a method that you're both comfortable with. Also, some techniques work better for some babies than others, so if one technique works amazingly well for one child, it may not work for your next, so you may need to adapt the method. Now it's time for my number one tip. The secret to effective sleep training is consistency. Sleep training will only work if a consistent approach is used. If it doesn't work, then try again the next night. Week by week, it will become easier and eventually your child will be sleeping through and managing to fall asleep on their own. It's really important to remember that sleep training is not going to work perfectly every night. There will be times where your child will regress and will not be sleeping through the night. Maybe they're unwell, they may be teething, you may be on holiday and all sleeping together, or you may have travelled through different time zones. After these brief episodes have passed, go back to your sleep training techniques and stick to them and persevere. It may take a week or so, but once your child has the tools to sleep well, they will quickly settle back into the routine with minimal fuss. These are the same techniques I use successfully with my 2 daughters and have used on many of my patients, so I'm confident that they will also work for you. To check out more videos, please subscribe, like and post a comment. Please visit my website to download your free parenting guide for 1 to 5-year-olds. If there's an interesting topic or something you would like to see covered in a video, please let me know.